Inpatient means you sleep there, you live there, you've got nurses 24/7 monitoring you. Whereas outpatient care, generally, you could be home. We're very fortunate. All of our programs, we also allow boarding, so someone who isn't outpatient but is from, say, an hour or 2 hours away from our facility or even further can actually stay with us and board there while they continue these services. The two levels of outpatient care that we have, where we offer boarding for, one is called partial hospital, and that's a stupid name, I think, by the insurance company. I don't like it because it makes you think partial hospital. That means you're in the hospital partially, and so I guess what it is really is 20 plus hours a week of treatment. It's usually 5 or 6 or sometimes 7 days a week, depending on the program. Ours have all variations of that, and allows people to really have support, 4 or 5 hours a day. 4, I guess 4 is the minimum, 4 to 7 days a week. It's called partial care. The final level of care where we offer boarding for is called intensive outpatient. And that's usually just 3 hours a day, 3, 4, 5 days a week. And the ideal candidate for an intensive outpatient program is someone who's now back into the workforce, and they work during the day and come in the evening for 3 hours, 3 days a week. It's really, as you could tell from the severity of support, we're going from the most support, or intensity, I guess, of support. We go from the most support of 24/7, every 15-minute checks, all the way down to 3 days a week of support, 3 hours a day. And it's a continuum of care. I see those stages taking 45, 60 days for someone to complete. And at that point, we're just barely touching their disease. I think someone with alcohol use disorder, severe, who's gone through detox, really is in detox for almost a year till their brain continues to stabilize. The cravings diminish, the anxiety diminishes. If there is depression, it diminishes, and their sleep stabilizes. It can take a year. And so these treatments, ours is at least 45, 60 days. It's not a fixed number. It's very individualized, but we're really trying to get an individual on the road to recovery. And then when they leave our facility, they can go to an outpatient setting, and a true outpatient setting means they live at home, and then they're able to come in for treatment, maybe just once a week. But they're going to meetings, AA meetings, NA meetings, that kind of thing.